Hello and welcome to Majlis podcast by Emirates Hospital Group. My name is 𝗠𝗷𝗶𝘀𝗀 and I'm a family medicine consultant. Today is a great pleasure to have Dr. Noha, our neurology specialist, who's going to talk to us about headaches and migraines. Dr. Noha?
Hello, Dr. Wael. Thank you for hosting me today. I'm Dr. Noha Abdelwahed, specialist neurologist at Emirates Specialty Hospital, and it's my pleasure to be with you today.
Most welcome. Today we have a small challenge for you. We're just going to tackle headaches and migraine. So please tell us more about it.
Yeah, headache is a very common disorder. It's one of the most common complaints we encounter either in our practice, either in our clinic or even in the emergency room. It's one of the most common conditions worldwide, usually more common in females than male. Females suffer of headache, and it should gain a very good public concern, because we see some patients are suffering a long time without knowing how to deal with the condition. And headache has more than different type, and it causes lots of lost working days and productivity all over the world every year, and it has now good treatment. Now we have good options for treating such a condition, which may seem simple to some people, but it's for sufferers of migraine or headaches or long-time sufferers, it's really a disabling condition.
That's very reassuring to know about the treatment, but just out of interest, and also as a family medicine, I agree with you. I mean, there's not one condition that cannot present with headache, in my opinion. So can you just briefly tell me the main differences between migraine? Because we hear it a lot of people saying that I have a migraine. It's commonly used as in kind of like now a slang word that whenever I have a headache, I say I have migraine. So can you just briefly tell us about the key differences between both conditions?
Headaches are a broad spectrum of disorders. We have the primary headaches and the secondary headaches. Secondary headaches are the least common, which could be due to tumors, medical disorders, secondary to other medical disorders. The most common is the primary headaches. Primary headaches has multiple different types of headaches. Either we can classify them into migraine, tension type, cluster headache, or what is called the autonomic 𝗘𝗺𝗃𝗃. But the most common type is the tension type headache and migraine. What is the difference? We will speak better about the most common.
Please.
The migraine and tension type. Tension type headache is a compressing headache, which comes lasts more than 4 hours a day, and it comes when it comes, the patient is telling you, I can manage a headache. When I work, when I do any activity, I just can ignore the headache. It can be manageable. Migraine is a different headache. It's a disabling headache. We can never tell that migraine is a mild headache. Migraine is either a moderate or severe headache. The patient will come suffering by pulsating headache. It's not necessarily a unilateral headache. It could be unilateral or bilateral, associated with sensitivity to light, to sound. Patient cannot turn or bend the head. Females cannot even comb their hairs. So it's a disabling headache. And patient will come and tell you, whenever I had an attack, I cannot do anything. I just can sit. I just want to sit calm or sleep because I can't even turn my head. So it's a disabling kind of headache for working people, for women, for children. Unfortunately, it affects all age groups, from pediatric age group up to old ages, and women, of course.
Yeah, I mean, there's always, unfortunately, gender inequality within medicine, but within your safe hands, I'm sure they will be getting the right treatment. Which brings me now to the next question, which you mentioned. You said there are options, because some people are kind of used to the old treatment that where sometimes they get frustrated. We've been on those medications for many years. You mentioned that there are new treatment options. So there is hope. Please tell us more.
Yeah, there is hope always. Now we have an era. We are in a good era for migraine since about 6 years. There are new treatments for migraine. Let me first speak about the previous era. We used to give analgesics for migraine. You will not go to, when I have a headache, I will not go to consult a physician because he will give me analgesics. So people taking either simple analgesics, NSAIDs and acetaminophen and like, or even triptans, and we all know the side effects and contraindications of such medications when people will take them without even consultation.
Absolutely.
Now the era is different a little bit. We have migraine-specific medications. We mean medications which target the migraine, specifically FDA approved for migraine. Many patients come to my clinic complaining of other complaint rather than headache. And then when I ask a simple question, do you have headache? He said, yeah, all of my life.
Yeah.
They just, they feel like it's hopeless. Why should I complain? There is no treatment. You will give me Panadol. You will give me any analgesic. It will not. Now the treatment is completely different. And it's always, we tailor the treatment according to different patient groups. Every patient should be considered differently after interviewing with the physician, the neurologist, and taking good history. And we speak of the treatment, we don't only speak about the medication. We have to speak about the lifestyle modification. We have to address the triggering factors. What triggers your migraine? First, we have to explain to the patient that migraine is a genetically predisposition. It's a genetic predisposition. We will find a strong family history, or even without a family history, migraine is a long life condition. The way is how to tame the migraine. This is the idea, how to tame it and to try to decrease the frequency and severity of the attack by avoiding the triggering or precipitating factors. So let's speak for the triggering factors. Lack of sleep. Food is very important, the diet, our diet. Lack of, patients who fast for a long time and go to work without taking breakfast, who are migraine prone, they will get the headaches. That's why we find in the days of fasting, patients will come, first days of Ramadan or something like this, patients will come with severe migraines. Because prolonged fasting with decreased sugar level in the blood can trigger severe attacks of migraine. Food like processed meat and all canned foods and preservatives, they contain sodium monoglutamate, which is a well-known trigger for migraine. All preservatives can trigger migraine. Old and fermented cheese can trigger migraine. So it's different. And I am not telling that each patient has the same trigger. It's different. That's why I'm telling you it's taken individually when you speak for migraine. Lifestyle, sedentary lifestyle, obesity, all studies find a very good connection between obesity and migraine. Depression and anxiety. There is a vicious cycle between migraine. Depression will lead to migraine, and migraine will lead to depression and anxiety. It's a vicious cycle. So it's multifactorial. We have to address all the factors which can trigger the migraine, so that when I give, just don't give medication. We have to stop the triggering and lifestyle modification. This is very important in patients with migraine.
Absolutely. And I think this is where my job in a way overlaps with yours, because talking about preventive measures, talking how we can do, and that's what usually, and I'm sure you do the same with your patients, is that yes, I might have the right treatment for you, but there is something you have to do yourself as well, and basically looking after yourself. And that's good. At least it's a shared, individualized process. Now, you mentioned the treatment, and just one question about the treatment before I carry on. You mentioned it's FDA approved and the new treatment options. Are they available now in Dubai?
Yeah, I tell you, Dubai, Emirates, UAE was the second country to get these medications after it was approved in USA. So we are lucky here to have these medications. They are available since, I think, 2018 here. So we have many different medications, either injectables, either now we have the oral medications, because some people would have the injectables are either subcutaneous or IV medication. And we have now oral treatments, and we have now anti-CGRP treatments, which are available for even for acute attacks, not just for chronic migraine. And recently we have the new medication, which is intranasal spray for migraine prevention, anti-CGRP. So now patients with migraine shouldn't suffer. They should come to the physician, should be treated well, should be gain the best medical care according to their condition. We tailor, as I told you, the treatment according to the patient needs. For example, if a patient is gonna get pregnant, the treatment will be different. Especially, its migraine is a disease of childbearing period. So breastfeeding, and we have to take care of this because they still are not approved during pregnancy and lactation. But we have other solutions, of course. There is Botox injections. There is different medications. But I'm speaking about the new medications, which are really changed the life of many patients.
That's very reassuring. It's very promising. I'm happy to hear that. So, which means soon we cannot use the headache as an excuse anymore for skipping work and duties, right?
Yeah, because we have medications that can abort the attack within 30 minutes.
Oh, great.
Yeah.
Now, in terms, and I think you alluded a bit to it, so I just want to come back to it, because you said a lot of people, and I'm joking about the work and skipping duties, but like the question is kind of coming from the foundation that yes, headache is a debilitating disease. Migraine is actually a debilitating disease where people miss on a lot of social, on physical activities, on their work. They're not even productive. So what are the key challenges for individuals with chronic headaches and migraines from your experience?
The availability of medicine for them, because as you said, that usually the challenge that people with migraine is not seen. It's a subjective complaint. It's not objective. So some people, they come, they said, my boss is or my manager is blaming me for not coming. They don't feel the pain. People, I cannot see your pain. When you are in migraine, you say I have migraine, but I cannot see it. So the challenges that really we have to do awareness about this. It's really debilitating. People will not understand you when you are in a migraine. I have patients coming, they are working in finance, or doctors getting migraine during an operation. Migraine is underestimated condition. It's really debilitating. Or I have school children or college students who come with migraine, severe attacks of migraine. They cannot go to the exam, they cannot concentrate, and they are even blamed by their family. So it's a big challenge for us to convince the community that this is a very debilitating condition.
Yeah. And
because it's subjective.
You're
you
right.
don't see the migraine.
That's a very good point. And even actually, I must admit, as a doctor, we might also be sometimes falling into that kind of subjectivity where, oh yes, headache, everyone else has a migraine. So it's today I'm learning from you, so thank you for this.
Yeah, it's even underestimated by healthcare professionals. You see, I see patients who coming. I told many physicians before I have headache, but they didn't address the complaint. It's even in our practice, medical practice, sometimes it is an underestimated complaint.
So the education will be actually to colleagues and to the general population. Absolutely. Very good. So we said that, yes, a lot of people live with this headache. They accept it. They've been living it with 20 years. I take the odd paracetamol, the odd anti-inflammatory. So when do you think I should come to see you? I mean, like I said, they probably gave up because I've been having it for years. So when do you think someone should come and see the doctor and seek professional help?
See, again, we'll see when to see a physician. There are red flags which the patient should go direct to a physician if they are there. This is the secondary headaches. I'm speaking of migraine, I'm speaking of headache in general. If patient is having headaches, new onset headaches like in 40s or 50s, and he starts to get new onset headache, which is different. If there any change in the character of headache you're having, headache is associated suddenly with vomiting, which you don't use with this. Headache is not responding to medication, which was responding before. Headache is associated with fever or any weakness in the body or blurring of vision. These cases should head to the neurologist directly to be rule out secondary causes of headache. Regarding the primary headache, if a patient now we target even episodic headaches. Sometimes you say patient come to say I have four headache attacks per month. You have to ask about the severity. They are 4 headaches. They are really debilitating. Especially we see this commonly in females in the premenstrual headaches. They say I cannot work or move or do anything for complete 2 or 3 days during my menstruation or premenstrual because I have severe headaches and nobody can understand. So it's 3 headache days per month that are really worth being addressed. So it's not only the frequency, it's the severity of the headache, the associated symptoms and the bothering symptoms. If I'm working in front of a screen and I'm having severe photophobia and a sensitivity to light, I cannot work anymore in front of a screen. People working, guys, I have a patient who she's working as a DJ. When she gets the attacks, the sound is very irritating for her. So we have, so if she had one attack, it will be very difficult. So we have to address not the frequency of migraine as much as we add the severity, how the impact of migraine on your life. It affects your social life. You don't attend social gatherings. Some people are afraid to go to social gatherings because they are afraid that you get a headache. And ironically, we have patients I have some patients who come to say, all the week I'm very okay. Once the weekend starts, I get severe headaches. This is called weekend headache. They oversleep, or they wake up lately, they change their sleep pattern, they go out, they eat, they socialize, and they get headache during the weekends. So you got me? So it's different.
Fair enough. So I understand. So basically, kind of course, if we remove the red flags that you mentioned clearly, anyone who's life is affected, their quality of life, their work is affected, then please come talk to the doctor and seek help now with the new treatment options. It's amazing to know that these exist. So, Dr. Noha, that was a very insightful session, and thank you very much for all the information. Any last message you want to share with our audience today?
Yeah. I would like to say that it's very important. The lifestyle is very important in management of headache. Please take plenty of water. Don't skip your meals. Hydration is very important. Avoid going into hot weather for prolonged hours. Take a good night's sleep and try to avoid disturbance in your sleep pattern. And try to avoid fast foods, because we are now in an era of people are taking a lot of fast food. Try to go back to our Mediterranean or the healthy food diet, diet, and exercise. Exercise is very important in treatment of headache. And if you have any other medical conditions like hypertension, diabetes, cardiac disorders, you have to address them well, because they add on to the headache problem. And at the end, if you feel that the headache is affecting your quality of life, kindly don't hesitate to consult your doctor, because it's easy to manage if the triggering points and the condition is well diagnosed.
So thank you again, Dr. Noha. And this is the end of our session today. I hope you enjoyed it, and stay tuned for future sessions.